What is pelvic organ prolapse, and how do I know if I have it? Hi, welcome to our Ed Talks, little snippets of education to help you heal and feel empowered. I'm Justine Calderwood, pelvic floor physical therapist and birth recovery specialist. I want to dive into this topic of pelvic organ prolapse. First, I want to say it's a pretty big topic. There's a lot that we can talk about, from knowing if you have it, what does assessment look like, what does treatment look like, what can be done. So you might have a lot of questions, and I decided I'm going to do a series of Ed Talks on the different aspects of pelvic organ prolapse. So with this episode, we're going to talk about a little anatomy. We're going to go over the types of pelvic organ prolapse and some of the general symptoms that you might be experiencing if you suspect that you have pelvic organ prolapse, or if you have been diagnosed and you're here to get more information. First, let's talk about some anatomy. Here I have a female pelvis. We're looking at it from the front. You can see the pubic bones here in the front, and you can see how it creates this kind of ring as it goes around. If you were to put your hand on your hip, it would land right here at the top of your pelvis, and your back is stacked along the back side, you can see. So as I turn this around, we're going to be able to look inside of this pelvis, and you can see from the front, we have, from the front and just behind the pubic bone, we have the bladder, we have the uterus, and hopefully my lighting's okay if you can see the rectum back there. Now, imagine that the rectum, this has been cut, but the rectum continues into the intestines and the digestive tract. So when we talk about pelvic organ prolapse, it really refers to any of these organs falling down or descending down from their expected position. Now, you might have heard of staging a prolapse, and that means that refers to how far has that organ descended down from its expected position, which I'm not going to go over in this video, but I do want to say something a little bit more about the anatomy. So the bladder exits out of the body through the urethra. So if I turn this upside down, this would be like a woman lying on her back, face up, pubic bone here, tailbone underneath. So hopefully you can see this. I'm going to try to change my lighting. There are actually three canals, or three exit points from the body. One is through the urethra, up a little bit more towards the front side, and that's where the bladder exits out. Then we have the vaginal canal here. So that's where the uterus, the cervix, they reside there in that vaginal space, and they exit out that way. So the cervix is part of the uterus. It's the opening to the uterus. Then we have the anus down here, where, of course, the rectum is going to exit out. So I tell you that information because these organs can prolapse. So it can be the bladder, but you can also get a prolapse of the urethra. You can get a prolapse of the uterus, but also of the cervix. And you can get a prolapse of the rectum itself and the intestines. So let's talk about the names for different types of prolapses. If there is a prolapse of the anterior vaginal wall, that can be a prolapse of the bladder, which is called a cystocele, or the urethra, which is called a urethrocoele. So if I pull this organ out, now this is just a little demonstration, a little model, but you can see the bladder here, and then the exit out would be the urethra. So again, cystocele or urethrocoele. A prolapse of the posterior vaginal wall, meaning towards the back, can be a prolapse of the rectum, which is called a rectocoele, or even of the intestines, which is called an enterocoele. So those structures can come down, and again, depending on how far they come down, it can even exit, to be honest, outside of the body. Another type of prolapse can be referred to as an apical prolapse, but it can happen with the uterus and the cervix, and that's called a uterine prolapse. Now, I do want to tell you that you can have one organ that's prolapsed, or you can have multiple. So there can be a combination of different organs that can prolapse at the same time. The other thing I want to cover in this video is going over just some general symptoms that you might be experiencing if you suspect or have been diagnosed with a pelvic organ prolapse. One is a feeling of pelvic pressure and heaviness, and that can happen into the lower abdomen, kind of top of the pelvis, but even lower down into this perineal area, down towards the genitalia. So again, just a pressure, a heaviness. It might feel like a bulging where you might actually see some tissue or feel like when you're wiping, or if you've done a manual exam or, kind of feeling around to see what's going on, you might feel a bulge or physically see it. I'm going to show you on this model here. This is just a silicone model. So you can see here, we have the labia here, the vaginal opening there, and the rectum down. So for some women, if they were to kind of open up the labia and look, they might even see like some pink tissue right there at that vaginal opening, or even you could, imagine that happening down here at the rectum where it kind of out pockets a little bit and you have a little extra tissue there. So there you have it, some basic information about pelvic organ prolapse. Stay tuned, and we'll be doing some more Ed Talks on this topic. If you're new here to our playlist for our Ed Talks, look around. We're answering some common questions related to pelvic floor health. So see if there's other questions that you are curious about. The other thing that I want to say before I sign off here today is if you are struggling with pelvic organ prolapse, if you've recently been diagnosed or you're gathering information, or you even just suspect that you might have one based on maybe something you read or a video that you saw, please reach out if you want some more guidance with this. I would be happy to get on a phone consultation with you or do a discovery session in person. So the best place that you can go is our website, healingspotpt.com, and pick whatever option is the best for you at this point. Thank you.